Good morning. Dean Charney, thank you for your understanding of our program and our mission, and for communicating it so well. I would like to thank Jim Tisch, who is a new chair of the Mount Sinai Health System Board of Trustees. You and the other trustees have always been so supportive of our program. I also would like to thank the Mount Sinai Auxiliary Board, administration, faculty, and staff. You are all incredibly supportive and cheerleaders of our program. I would like to add my welcome to all of you here today, and thank you for waking up and getting up so early to come and help us celebrate our wonderful honorees, great staff, and the amazing young people that we serve. I would like to congratulate and thank each honoree and thank each co-chair. You did such an amazing job. Look at this room. Thank you. I would like to recognize and thank the Business Professional Council under the leadership of Susie Greenwood and Beverly Boudon for spreading the word about the center and connecting us to so many people. You are great ambassadors. Our Young Professional Council, under the leadership of Yasmin Mack and Jerry Bruno, has been working directly with our young people, raising money for the center and volunteering. And they are even volunteering here today. Thank you. We have other people volunteering here today, and also people who volunteer with us year-round, including people who ran the New York City Marathon a few weeks ago and are here with us. I want to say to all the people who volunteer with us in any way that your help is priceless. We couldn't do what we do without you. And can all the volunteers please stand, the BPC, the young professionals, the people volunteering here today. The staff from the Seafeld has been here since very early this morning, and they are doing a great job. Let's give them a round of applause. I would like to thank Eileen Solomon, Mount Sinai's Director for Special Events, Allison Hagerman, and other staff who assisted Eileen, and her colleagues from Bell Events for also managing this morning. Thank you. Thank you, Checking Tech. Your expertise and technology makes registration so much easier and so much pleasant. And you are doing all this for us pro bono. Thank you. Many of our staff help with this event, but without Rebecca Anapol, Ken Peak, Christine Sogomonian, Daniel Zuckler, Ronnie Taveras, and Robert Wasserman, this event will not have happened. Thank you. To all our staff and trainees, thank you for loving our patients the way you do. You embrace them with such warmth and provide such great care that it helps them heal and live healthy and productive lives. Can all the past, present staff, trainees, and patients please stand? Adolescence encompasses a very important and exciting part of life, starting with puberty at about age 10. The pubertal, socio-emotional, and neurobiological development of adolescents are very distinct. We all know when people are in adolescence. In adolescence, the brain connection between different regions becomes stronger and more efficient, and unused parts of these connections are removed. This means that the adolescent brain can adapt very well. Therefore, the trajectory of adolescence can be influenced both negatively and positively at each stage of development. The young people we have the young people that we serve at the center have had very colorful lives with many positive and many not so positive experiences. However, we must remember that the challenges they face do not have to determine their destiny. With the appropriate support at the right time, these young people can heal and thrive. Small changes in their life trajectory can make a huge impact in their life outcomes. Lack of access to health to receive the services they need is one of the negative influences that can lead to many negative outcomes. Coming to the Mount Sinai Adolescent Health Center is a positive influence because it makes it easy for young people to get those services they need in a way that they can understand and in a way that they can use. We incorporate in our center's design the lessons that young people teach us. They teach us what is going to make it easier for them to get the health care that they need. Things such as timely appointments, the ability to walk in, to receive confidential services, to be able to get as many services as possible in the same place and perhaps during the same visit. 70% of our patients are uninsured. They do not have health insurance and have no ability to pay. But they need health services, even if they don't have insurance or money to pay. We want to make sure that the more than 12,000 young people ages 10 to 24 we serve every year have no barriers to get those services they so desperately need. At the Mount Sinai Adolescent Health Center, no patient is ever charged or billed. Not a single penny ever exchanges hands. We pay for the laboratory tests, medication, and we give them Metro cards. We do all this spending on average $1,000 per patient per year. It's an extremely cost-effective program. As you heard, we have a comprehensive, youth-friendly health and social services system of care designed to meet the developmental needs of young people. And we are accredited at the highest level as a medical home for them. We integrate physical health, sexual and reproductive health, dental, optical, health education, and behavior and mental health services, from head to toes, from mental to dental, all under one roof. And we also have legal services. In addition to our center on East 94th Street, we have full-time clinics inside 6 high school buildings. And through these school-based clinics, we serve 24 high schools and middle schools. Despite the fact that many of our patients come from disadvantaged backgrounds, they have great outcomes. Most of our patients graduate from high school, many attend college, some go to graduate school. They are very hardworking. Our patients have lower teen pregnancy rates, have very high rates of immunizations, and have their mental health needs met. If you ask one of the young people that come to us, why do they come to us? They will say because they feel welcome, respected, connected, safe, not judged, and accounted for. Without our program, the majority of these young people would go without the services they so desperately need, and their outcome will not be as good as they are. We see adolescents not at a period of problem to be solved, but at a time of opportunity where investment in these young people's well-being has tremendous payoff. That's why we work so hard on their behalf. The Mount Sinai Adolescent Health Center is an oasis in the middle of New York City, and it has become a beacon of hope for adolescent health services around the globe. Each of you made this possible. You, and you. All of you, all of us make this possible. And I want to thank you for helping us give young people a place of healing and a place of hope. Thank you all.